for 2016, we will see that for the communicable diseases, it's basically the same diseases that persist within the population of the Belize District, which would be respiratory infections and gastroenteritis. But we also have other conditions that appear, such as vaginal infections, which also predominate within the population, primarily the female population. In terms of the non-communicable diseases, again, we are seeing a transition, like all the other countries around us, that we're moving away from communicable diseases towards non-communicable diseases. So we have also high incidences and also prevalence of non-communicable diseases such as diabetes, hypertension, asthma. So these remain the top diseases that are affecting our population as such.
Okay. In terms of the number for those non-communicable diseases, the cancer, diabetes, hypertension, the numbers, are they higher 2016 than in previous years, or have we remained perhaps at the same in the number of incidences you've seen?
Okay, in terms of the new cases, which would be the incidences, this is actually the first year that we're trying to get the real numbers. And this is only for public clinics because we don't have the data for private health facilities. So we've started to do this because we want to know how many cases per month we are diagnosing within our health facilities. And this will give us an idea as well of the prevalence of the disease within the Belize District population. So what we're noticing is that we have approximately 12 patients being diagnosed per month, which means that the disease is present within our population.
Now, as it relates to the causes of deaths in 2016, what can you tell us about the factors associated with those?
So two of the causes that predominate within the top 10 causes of death would be cardiovascular diseases and cancer. And these are directly related to the non-communicable diseases. So diabetes, for example, hypertension. If we look also at other risk factors, which would be hyperlipidemia, so high fats within the bloodstream. If we look at obesity, these are contributing factors to the causes of death. Now, we know that we also have high crime rate within the population. Homicide is also there. The data that we have presented is only up to October of 2016. So we do expect that there will be a higher number of cases of cardiovascular diseases than homicide when we do the final end of year report.
You can look at all of this and kind of summarize, how would you maybe rank or class the health of our Belizean population at this time? Is it, in dire need of interventions? Are we okay? Are we down in the middle? How would you describe it?
I'd say we're between moderate to poor health. And this is because the statistics show that, one, we're not doing much to prevent us from getting ill. So the bad diet, for example, so we need to change the way we eat. We need to change our lifestyle in terms of the intake of alcohol, smoking, tobacco. We need to also increase the intake of fruits, vegetables, increase of water within our diet. So these are things that the population need to be aware of.